Yeah, doctor, that sounds really good and all, but I'm gonna have to think about that.
Don't get caught with your pants down when you get this objection from patients. Let me set the stage for you. You're sitting in front of the client during the report of findings. This is always visit number 2 for me. And the conversation ends abruptly with uncertainty, turning you into a salesman, backpedaling, trying to win them over. Today, I'm going to show you my favorite strategy in order to avoid this situation completely and stop it in its tracks before it even starts. And if you stick with me until the end of the video, I'm going to give you the bonus material, which is what to do in the tiny circumstance that you get resistance to this. They don't actually want to think about it. They're being polite because they are uncertain about treatment. They're uncomfortable discussing finances or making a decision, or they flat out just don't trust us as doctors. It is our job to create the safe environment where patients feel like they can make a clear decision, yes or no, without feeling pressured. The best way to prevent the I need to think about it routine is to address it up front before the report of findings even begins. Let's assume that you're sitting in front of your patient on your report of findings. This is always visit number 2 for me, and it sounds something like this. I've had a chance to look over your x-ray pictures and the MRI images, and I'm feeling really confident that we have a good non-surgical solution to help you get back to lifting your grandkids, playing golf, etc. Before we get started, I'd like to set some expectations for our conversation today. When we get to the end, I'm going to make some treatment recommendations, and if you decide that you'd like to move forward, that's wonderful. But if you decide that it's not for you, then I want you to know that it's perfectly okay to say no. But here's what I'd like to avoid. Sometimes patients say, I need to think about it just to be polite. And I'd feel more comfortable you just telling me no if that's how you feel. Can we agree on that? What this does is it sets a very clear expectation, and also it gives the patient a no option, which helps to reduce their anxiety, and it eliminates the need for them to stall with indecision. There's only 3 things that happen when you use this strategy. 80% of the time, clients are just going to agree to it. They don't want to be confrontational, and it's just easier for them to verbally agree to say yes or no. You're not asking for anything that's unreasonable. 5% of the time, you're going to get a very difficult buyer where they had already decided before they even walked in that they don't want to work with you, but they're there anyway to hear you talk for whatever reason. We're not going to pay attention to those because they're never going to close anyway. 15% of patients are going to still be on the fence. And this is where you have to be very patient, and you have to continue to circle back to this conversation until you get the verbal agreement to say yes or no when we get to the end. Sometimes what's going to happen is patients will then follow up with a question. They don't want to get pinned down with a yes or a no. So they'll say something like, can you just proceed? Or what if I do have to think about it? Or I just want to know how much it is. Sometimes they just blurt things like this out, and you just have to kindly and politely circle back to the agreement. It's perfectly okay if you want to say no to me, but what I'd like to avoid is saying I don't know or I need to think about it. And most people are just comfortable with that. Here are some really common mistakes that doctors make when they try to use this strategy. Number 1, do not rush it. Take your time. Let the patient know that this is something that you've done before, that you feel confident with it, and let them feel that confidence in your voice. Number 2, avoid sounding confrontational. I know that internally as a doctor that this is something that you may feel conflict with, but if that comes out in your voice, then the patient's going to feel it, and it's going to make it very hard to move forward. And number 3, don't skip this step. I know that it may feel unnecessary, but using this strategy helps to build trust and give the patient a sense of confidence moving forward with the conversation. The I need to think about it routine is a common symptom of hesitation or uncertainty. By setting clear expectations at the beginning of the conversation, you empower patients to make clear decisions without hesitation. This not only improves your case acceptance, but it builds stronger relationships between you and your patients.